So today we've got Lucy on the Vlogcast, and I've asked to come along because she's part of our preferred outsourced coaches that we use, and she's a qualified physio. She's been helping our athletes when they've got injuries, especially at times during lockdown. You've been an invaluable service. So we give that to all our athletes, whether that's with Triforce or with Fellow Performance. And really what I've got you on today to do is quiz you a little bit about common injuries that cyclists often see and why they come to the forefront and what we can do about it. So just tell us a little bit about yourself, Lucy, and how you're helping our athletes.
Yeah, so I'm a physio based in Southwest London, but obviously due to COVID started going online, which was a bit of a novelty, obviously, in terms of physio, but it's actually worked really, really well, and seeing people all over the UK. And how it all works is obviously it's all via video. So you can actually see how they move. You can see if they've got any imbalances, any weaknesses there, and then we kind of address that. And I think people, especially part of your club, everyone's quite independent. Everyone wants to manage their own injury. So actually it works very well through exercises, and it allows us just to give them that self-management and control.
Yeah, I think what I've found and what they've found, it's been, with COVID over the last year, it's been such an unusual way of speaking to a physio, but such an easy way of doing it. Definitely. That actually once they start working with you, they realise actually it's a really quick and efficient way to get straight to source, right?
Definitely, and also we can then chat and we can talk about their training, and we can obviously modify anything that needs to be done. So it works really well working alongside you guys and them as well, being able to manage everything.
I just think it's been super valuable. So the reason why I wanted to chat was because quite often I hear athletes and cyclists especially talking about getting injured. They present knee problems and things like that. So if we just break it down and leave it to you to sort of talk about what you often see and why, I'll just hand it straight over to you.
Brilliant. Yeah, well, I think obviously most often these injuries do occur because of an increase in load, and we all see that. You suddenly got an event, start to panic, start to increase it, and I think it's about that time on the bike, and it's not having that necessarily the coaching or people alongside them to help guide them with this. So obviously coaching's invaluable. You can't not have someone who you're accountable to, who's monitoring your kind of numbers, monitoring everything. So training intensity and in terms of the load and time on the bike, that's one of the causes that I'd say would come with injury. And also bike fit as well, which is something I'm really seeing more and more of, especially during the winter months when people turn to the turbo, where it is a bit of a different setup. They're not necessarily used to the positions they're going into.
So that's just really an interesting thing. So turbo training, because sat inside, if your bike's not set up and the bike's rigid and you're fixed on it, that's going to present issues fairly quickly, isn't it?
Definitely. And obviously with running and stuff, you would expect that kind of change in load, and the fact that you're pounding the pavements is going to vary the load. But with cycling, you are fixed in that position. You're not necessarily getting that change in load through your body, but it's the repetition of doing that and those cyclical movements. You are just pounding away on the same soft tissue structures. And so if it's set up correctly for you and your biomechanics, then it's something that's going to lead to potential injury. But saying that, obviously all the training and everything that you do with them, which sounds like you do really well with them, alongside that is the recovery strategies to the coaching. So you can't have a training program without that adequate recovery in terms of nutrition, sleep, fueling, obviously, everything like that. It all plays a part. And I think everyone always thinks of, the injuries come about from lack of stretching. That's one of my pet hates when people come to see me and they think, oh, sorry, I haven't stretched and that's why I'm injured. And I'm a strong believer that if you're progressing your training well, and you're recovering well, the only two important things you really need to consider, especially as a cyclist, is strength. Are you strong enough to deal with the load that you're putting your body under? And mobility. So mobility is different to flexibility and stretching of muscles. Mobility is more kind of the active movement around a joint. So people are stiff in the lower back, people are stiff in their hip joints. And especially if cycling, if they are slightly older, you're going to expect that. And it's how you tailor their training and how you tailor their bike fit, let's say, to that and their body biomechanics. So I don't know whether you obviously give strength training programs, don't you, alongside the program, and a bit of mobility as well?
Yeah, so we give people reminders to do certain mobility movements after they've done a particular, whether it's a run, bike or swim.
Brilliant.
And for the cyclists, obviously, we're just getting them to focus on working through the anterior and posterior chain. So they've got balancing into their training, and to make them as functional movement pattern as normal as possible, because a lot of people just sit down all day.
I know.
And that's definitely something we've seen in COVID, right?
Yeah.
So a lot of people have been injured because they're seeing hip flexors tighten and shorten because they sat down, hamstrings getting weaker, glutes getting weaker, and then they're trying to do the same training volume and not realizing that's what's causing problems.
Definitely. And I think a part of that being on your feet and everything would provide a little bit of strength that would allow them to get by day to day. But obviously, they're not necessarily getting that these days.
No. So I think one of the things I always get asked is when people say, "Look, my hip flexors are really tight."
Yeah.
Because I ride the bike. Is that actually the main problem? Because I guess it's a leading question, but it's like I hear this all the time, and I'm always thinking, well, it's probably a bit more to it than that.
Yeah, definitely. I mean, with hip flexors and hamstrings is exactly the same. They always say they're really tight, and they kind of just blame it on the fact that they haven't stretched. And it sounds like we're on the same path in the sense that I think muscles can either be tight because they're weak or tight because they're shortened. And yes, you say like with COVID and stuff, they potentially have got a little bit shorter. So objectively, they are shorter. But actually, when they're slightly weak, it's to do with where they insert onto the bone. So if you think about a pelvis, your hip flexors insert onto the front of the pelvis. And actually, if you're loading them a lot with your training, all they're doing is grabbing onto the front of that pelvis for dear life, and they're panicking because they're not strong enough to sustain the load that you're putting them under. And so it's an element of, are they weak or are they actually tight? And that's where you have to address the problem. And with that in cycling, you do get elements of them being tight, and they do lead to certain injuries, which we'll go into. But that's often because you've maybe ramped up your training a little bit more and haven't done that adequate recovery. There are obviously precursors to what brings that on.
Practically, the reason why you get tight hip flexors is because of the muscles being too weak or too short.
A combination or either. Yeah, exactly. Yeah. And they work in conjunction with the posterior chain muscles that you were mentioning earlier. So on your pelvis, you've got the hamstrings at the back. And if they're weak, like you say, they haven't been worked as they would normally, then they're going to be lengthened. Okay. And then the hip flexors at the front are going to shorten. And then you get a slight tilt in your pelvis, and it affects all the biomechanics throughout your body.
Okay. So it's really important not just to focus on the tightness, but to look at the bigger, as I was saying, look at the bigger picture. Yeah,
exactly. And that's when the people always turn to stretching if they do feel tight. And actually doing a static stretch gives you that temporary benefit, and if it's good to do if it gives you that short term relief. It gives you relief after a cycle or something, that's great. But actually, in terms of benefiting you, every time you do a hamstring stretch, you're going to be exactly the same in terms of flexibility. So actually doing exercises like deadlifts, where you're getting that lengthening component and the eccentric component to that muscle contraction, you're going to get a longer term benefit, and you're going to get a good stretch whilst also getting stronger for the bike. So it makes sense to incorporate those kind of exercises.
Yeah, right. And that is such a really important point to get across, isn't it? Is that a lot of people just focus on trying to elongate and lengthen, and they're not really getting into the grounds of what's going on with their sort of like all over mechanics and strength. Yeah.
Definitely. Yeah. You've got to look at the big picture. And with every injury that comes to see me as well, similar to you saying that, there's always a reason why they've got that injury. So there's a reason why that muscle's feeling tight. And you've got to look at the bigger picture, I think, in that sense.
It's such a good conversation to have, because I think I probably regularly talk to people about this on a week-to-week basis and say we need to look at working everything. So what, in my mind, what's the most common problem that you see, and how can we fix it?
Good question. So I think in terms of most common injuries of cycling, it would probably be the knee, mainly around the front. So you get anterior knee pain, and that's quite a generic term. But it's often underneath the kneecap itself. And this can come on very much from that change in load, so from that change in activity. If you suddenly, for example, increase the resistance in training and things like that, and you get tighter through the muscles. Or it can be from that bike fit position, so maybe a lower saddle or the seat's too far forward. So it's a combination of the two, which you do need to look at. And yes, they do lead to the fact that your muscles then get tighter, and it can then amplify the problem through your knee. So you do need to address that, but it's not just through that stretching element that we talked about.
Okay, all right. And that's fascinating, because you hear a lot of people saying that my knee hurts after they've been riding and maybe put on a little bit too much volume and load all at once.
Yeah, exactly. And that's okay. Like, you know, as you know, with training, like, you do need to overload to get that change and get that improvement. And then it's often, if you have overloaded a little bit too much and you get that discomfort, just pulling back a little bit and maybe increasing a bit of the mobility, a bit of foam rolling as well, just to go alongside it and help with that. And that will settle things down. But those aren't the be all and end all. And actually, alongside that, you should have that strength work and other elements.
Yeah. Okay.
Yeah.
All right. So when it comes to strength work, can we do stuff at home, or do we have to go to the gym?
Good question. So in terms of, I think there's definitely a part for the gym. I think it's really important to get that load, and especially as like triathletes, you do want to get like a good percentage of your body weight with like weighted squats and deadlifts. That is fundamental to try and get that in there. Whereas obviously doing that, the movement control and slightly single leg exercises, even for cycling as well, is all important. You can do that at home with slightly lower weight. So I'd normally recommend people try and do a heavy weight session once a week in the gym if they can, and then complement that with slightly lighter load at home, where they're focusing more of that unilateral single leg work.
Okay, so what in my mind, so from triathletes and cyclists, they can both benefit from going to the gym and doing specific posterior and anterior, mainly I guess posterior chain work in the gym, heavy load, and one session at home which is working on a bit more of for the want of a better term, functional movement patterns. Yeah,
exactly. Yes, and even going to the gym and having the leg press machine, although that's not functional, you're not up and standing, you're not replicating the running gait or obviously cycling things, it does give you that strength, that actual strength that you do need to put the power down. So,
and that's really such a great point to put across, actually, because I think a lot of people think if they can't go into the gym and do deadlifts and squats, then they can't, what's the point? And I think we align on this. It's like, if you can't do that and your movement pattern on a squat or a deadlift is pretty poor anyway, get in and do leg press. And do things that are pretty straightforward for you and less technical until you've developed the ability to get that technical side of your lifting in play. Does that make sense?
Yeah, definitely. And I think as well, alongside the training and stuff, sometimes it is easier when you're so exhausted just to go and sit on the machine and get the weights done. You're ticking it off. And it is tough to do, but it's still like that extra session that no one wants to do.
Do you know, I hadn't thought of it that way, actually. I've just, but actually it makes sense, right? You know, I'm really tired today, and I know that my movement pattern's probably not going to be the greatest, but I still want to strength train. I'll go and do something that will add benefit to my training, but I'm just not going to put myself in a position where I might hurt myself.
And it's difficult squeezing it around all your training as well, though, in terms of like obviously the endurance sessions and things, in terms of that, the physiological benefit. Do you advise your clients on that?
I think when it comes to just sort of blending it, that's where the coach comes in. It's just like, look, maybe you shouldn't be doing this day. Maybe just do like 2/3 of your training session in the gym today. That's good. Just to make sure that people aren't overloading themselves.
Definitely, it's balancing with everyone's day-to-day life, isn't it?
Yeah, it really is. And then I think what was the one thing I was going to ask you is that when it comes to cycling mechanics, you mentioned it earlier, is that saddle's too low. Something I see, and I think when I go and watch people racing, especially with especially in triathlon, you see people set up on their bikes and you always look and think, oh, crikey, that's way too low. That's got to have an impact on their spine, surely.
Definitely. And definitely. And I've listened to and obviously done quite a lot of personal development with some of the top British cycling physios in terms of podcasts and stuff. And they very much believe in, it obviously comes at a cost. And if you are like an amateur cyclist, you're not professional, you don't need to be in that heavy aero position, because the gains you're going to get compared to the discomfort you're going to get is not necessarily worth it. And being in that position, if you haven't, it does come down to your kind of intrinsic biomechanics. So like you said, if you haven't got that hamstring flexibility, actually being in that aero position or being in that low seat, you're going to get lower back problems because something's got to give. And so those are things also you need to work on. And that's when it comes down to getting that professional bike fit as well, to look and see whether you are flexing through your spine and therefore getting those problems.
And this is such an important part, and it's something that we talk about with all the athletes that come on board with us, whether with Triforce or with Fellow Performance, is that the first thing we would recommend everybody to do is go and get their bike fit, even if they think their bike fit's been pretty sorted and they've had it done for a while, because I think your flexibility and strength changes, and along with that, so does your position fractionally. And also, there's also the other thing that I was looking at from this perspective is like your first bike fit might have been terrible. And you just don't know. So you need to just double check it from time to time.
And if it's been a while, if you get even like certain really small things, like let's say you got a mosquito bite, you might one day you go on a cycle, you then shift your weight slightly, and that just alters your biomechanics and everything. So it's all about that alignment and just the way you then do that cyclical movement. Going back in to get your bike fit regularly, or getting it checked, even just filming yourself from the side and showing it to you or showing it to myself, we'd be able to see the picture of where potentially they are getting those niggles and the reasons for getting it. It's really important.
That's actually such a good thing, actually, you just mentioned. And it's just when people buy new saddles, for instance, they put them on, they don't think about their bike fit, and they may have put them in slightly too far forward, slightly too far back, a little bit too low, a little bit too high. This is why it's really important every now and again to go, hang on a minute, haven't done it for a while, maybe I should go and get a bike fit, just to make sure that they are in as optimal position as they can get in.
Definitely. And when I do physio assessments and stuff, obviously we kind of, if there's an obvious strength deficit or an obvious biomechanics difference that's going to cause their issue, then that's obviously an easy resolution. But towards the end of their kind of rehab, it's always good to see that posterior or lateral view of them on the turbo, because then you can see potentially what has caused it. And if they're then riding pretty pain-free consistently, I wouldn't make many significant changes. But if you could, because a small change does alter quite a lot. And that's what a specialist bike fit people would do. They would see that small change and test it and see how that affects symptoms.
Yeah, cool, good. So is there anything in particular that when I was speaking to you about coming on, is there anything in particular you wanted to chat about that you think is important to tell people about cycling and just staying as healthy as they can?
So I think obviously you've got the load covered in terms of training load and building that up progressively. And then you briefly talked about nutrition and recovery. I think in terms of avoiding injury, that's when the mobility and the strength work comes into it, as well as that. But then when problems do occur, there is 5 key things I could tell people to kind of think about when they do happen. The first one obviously is, the acronym is AEIOU, so the vowels, nice and easy to remember. Okay, you've got activity, which is your training load and any changes that you may have put on, and then you can kind of allocate the problem to that. You've got the equipment, and that's when your bike fit comes into it, or maybe you've got new cleats or you've changed something. Just try and think about it in that way. Intrinsic is the I, and that's the U. So that's when it's you're getting compensatory strategies. For example, you had a slight niggle in your foot, so on your right foot, you're starting to shift your weight to the left and your left knee is hurting. So you're starting to think about maybe slight changes like that. Or that's when your leg length difference comes in. You may have heard people talking about those kind of things, which can also alter where they're putting their load. And then the O is other. So that's kind of everything else. So let's say you've been ill for a week and then you come back to training. You start to feel a bit niggly in certain places. It's always good to be able to kind of allocate as to why these issues have come on. And the final one's unknown, so that the cause isn't obvious. But then if you can kind of focus on what you do know, then hopefully you can kind of get through what is happening in these niggles that are occurring and prevent them becoming more long-term problems. So I'd probably say if everyone kind of think about that AEIOU and try and think about those kind of reasons why you're getting those niggles, then hopefully they won't become more of those long-term, which are really going to affect your training and affect your events going forward.
I think that's a massive, valuable piece of advice given to people right there. So anybody watching this, if they just write that down, take the recording back a little bit and listen to that again, they can learn something from it. And then one thing while you were talking there, it just reminds me, actually, since working with you, a couple of my athletes when they're coming back from injury, I think they always see as rehab as being something that goes in a linear progression.
Yeah.
And since working with you, they've realised that that isn't the case, and there are levels of pain scale that potentially they can still train at, but they hadn't ever considered before, and there are levels of pain scale that they shouldn't do. So
Definitely.
if we round off with that,
yeah.
Do you want to maybe sort of discuss roughly how that works?
Yeah, so obviously when people present to me, it's often the fact that they can't do the activity they want to be doing. That's normally we'd all carry on as much as we can until we really have to go and see a physio. And I think the main rule of thumb is pain during the activity. If it doesn't go above that 4 out of 10, then you're doing okay. You're keeping it at that mild, minor pain level. Going forward after the activity, if it lingers for a little bit, that's okay. But if it then lingers into the next day, you then know that you're re-aggravating those soft tissue structures and potentially delaying the healing. Okay, so if you're coming to me for physio and we're trying to rehab it, I'd very infrequently tell someone to stop doing the activity they're doing, because obviously it has so many other benefits and so many other effects. And actually, if you pull them completely back from cycling, you're going to have more of an issue down the line getting them back into it. So if you can keep them going at that low level with that activity, it's really important to do it. But it's really important that they're on board with the fact that they're not aggravating each time they go out and do the activity, and that's then affecting their rehab going forward.
It's such a great way to look at it, and it allows the athletes and the cyclists just to continue along with their training and not feel like they're just losing everything. Yeah. And I definitely know it's worked a treat with some of my athletes this year.
Well, hopefully people also see it as an opportunity to get stronger. So although they're able to carry on with their training, they've identified some weaknesses, and that is all part of the training. Like, you should potentially, when you do like a trial long cycle or something, and you feel niggly in your hamstring, yes, you let it settle down, but then you should think, why am I niggling in the hamstring? Is it because I'm slightly weaker? Is there something potentially a little bit more going on that you could then address and get stronger in that area to prevent that? So I think, yeah, like you said, think of it as progressive and actually see rehab and physio as a way of getting stronger and taking it forward with your training.
Such a great way to look at it. It really is. Great. Well, thank you very much for your time.
No worries.
I'm just going to ask you one thing. If there is, I'm going to nick this from another podcast, so Daniel Lennon asks this all the time, but if there's one thing you can get people to do every day that would make them a better cyclist or athlete, what would that be?
Oh, very good question. I would say, as a cyclist, I'd say actually try, and I think everyone's quite good at doing their strength work and getting into the routine of doing that. But as a cyclist, I'd actually say try and incorporate a bit more lower back and upper back mobility to make yourself more comfortable on the bike. So using a foam roller for kind of leaning back. I'll try and give you some exercises. We can go through that and maybe give you something to put on your Instagram for kind of opening up your chest, opening up your thoracic spine, getting your lower back moving, just to make it more comfortable on the bike, because none of us are really used to, when we suddenly restart going back on the bike for that long period of time and you start to seize up through your shoulders and your upper back, actually being able to mobilize that spine and make it more used to it and more mobile. That would be something I'd recommend people do on a daily basis.
Brilliant. Thank you very much. Good. So just to cap off then, how do people find you?
So online on social media, I am Lucy Tri Physio. So yeah, I treat all triathletes. I have got a website under the same name, and I'm treating people in person in Southwest London at the moment, but otherwise online, which, like I said, is working really, really well. So feel free to get in touch.
What's your Instagram handle?
It's at Lucy Tri Physio.
Perfect. Brilliant. Good. Lovely. Thank you very much.